In this video, we're going to be covering some of the more common questions that I get about pelvic health. I'm Dr. Alex Hill. I'm a board certified physical therapist and I specialize in pelvic health and oncology. In this video, you'll learn what the pelvic floor is, why pelvic health is so important for any gender, and how pelvic health physical therapy can help with common symptoms and conditions that you might not even realize are treatable. So stop suffering in silence or wondering if your symptoms are normal or not, and keep watching to learn. So what is the pelvic floor? The pelvic floor is a group of muscles that form a supportive sling along the base of your pelvis. These muscles support organs like the bladder, the rectum, and for people with a uterus, the uterus itself. Besides supporting the organs, they play a big role in bladder and bowel control, or pooping and peeing, sexual function, circulation, and core stability for the spine and the entire pelvic area. And you know what's cool? Everyone has the same pelvic floor muscles. So you can see here on the inside, same exact muscles, and on the outside, same exact muscles. The main difference is that on this model, we have the pelvic floor muscles that create the opening of the vagina, but those same muscles will make up the penis here. So again, same exact muscles, that's the primary difference. But since we all have pelvic floor muscles, that means that anyone, regardless of your gender, can experience pelvic health issues and pelvic floor conditions. So when we talk about pelvic health, we're talking about the proper function of these muscles and the surrounding structures of the entire pelvic region. That includes your muscles, nerves, blood vessels, ligaments, and tendons. Good pelvic health means that you are free from pain and dysfunction in this area, and that you can rely on it for normal bowel and bladder function, good sexual function, and that you can just do what you love to do without any issues going on in the pelvis or with those pelvic organs. If you're having pelvic health concerns, a pelvic health physical therapist or a pelvic PT can evaluate and treat your symptoms. So when should you consider seeing a pelvic PT? Well, here are some common symptoms and conditions that we can help you treat. The first up is bladder dysfunction. So this is anything going on with the bladder. So if you experience incontinence, meaning you're leaking urine when you sneeze, you cough, exercise, or if you have urgency and you can't quite get to the bathroom on time before you leak, that is a major reason for seeing pelvic PT. Other bladder symptoms like urgency, going very frequently, maybe you have trouble emptying your bladder, you have bladder pain. These are all reasons that you can see a pelvic PT. They can help you figure out what your triggers are for your bladder symptoms, what's contributing to your symptoms, and help you retrain your bladder habits. Similarly, stool or poop incontinence or constipation that doesn't improve with diet alone, like increasing your fiber and water, can benefit from pelvic PT. A lot of people don't realize that there's different types of constipation, and sometimes it can be related to overactivity and incoordination of these pelvic floor muscles, meaning they're not working properly to allow you to evacuate your stools. A pelvic PT can help with retraining these muscles so that they're working correctly, and also help you get on an optimal bowel program. If you're having rectal pain, bowel urgency, these can also be addressed too. Next is sexual health. So a lot of different types of sexual dysfunction can be treated with pelvic PT. This includes pain during or after sexual activity, erectile dysfunction, a change in sexual sensation, or even leakage during intimacy. Pelvic floor PTs can help assess and treat your pelvic floor dysfunction, whether that means your muscles are overactive, they're too tight, or they're uncoordinated, maybe you have low tone. But regardless of what's going on with the pelvic floor, we can assess why that might be contributing to your sexual health symptoms and help retrain those pelvic floor muscles and improve your symptoms. Pelvic organ prolapse is a condition where one or more pelvic organs, which are the bladder, the uterus, or the rectum, move lower in the pelvis and drop into the vaginal walls. This can cause symptoms like vaginal pressure, heaviness, or bulging. and you might even feel something at the vagina with prolapse, especially when you wipe and go to the bathroom. Pelvic Health PT can be very helpful for most people pretty much at any stage of prolapse, but it's most helpful for those who have a mild prolapse compared to a severe prolapse. Pain anywhere in the pelvis, whether it's around the low back, in the abdomen, hips, or in the genitals, or deep in the pelvis itself, can benefit from an evaluation and treatment with a pelvic PT. Some example conditions include pain during pregnancy, especially if you have pain in the pubic symphysis area. Maybe you have pain in the SI or the sacroiliac region. If you have tailbone pain, if you have irritable bowel syndrome, chronic prostatitis, or endometriosis, any of these common pelvic pain conditions can be evaluated and treated by a pelvic health PT to help you reduce your pain, learn to better manage it, and get back to doing those things that you like to do with less pain. And finally, many cancer treatments like surgery, radiation therapy, hormone therapy, and chemotherapy can lead to pelvic health concerns. If you're having any issues or concerns during or after your cancer treatment, talk with your oncology team about seeing a pelvic PT. We can work with you before, during, and after your cancer treatment to minimize the side effects and address your concerns. So the most important things that I want you to remember from this video is that 1, everyone has pelvic floor muscles, and anyone can have pelvic floor issues and can be seen by a pelvic PT. And 2, it's never too late to address your concerns below the belt. So to learn more about what to expect in pelvic health PT, click the video at the end of this one to learn all about what your first visit and treatments might look like, plus my top questions that you should be asking your pelvic PT before getting started to make sure they're a good fit. Pelvic PTs can work with you to help you feel comfortable and confident with your body again, so take that first step. I also have several resources listed in the description below to help you find a pelvic health PT near you. Thanks for watching this video. If you found this video helpful, please like it, share it with others who need it, and subscribe for more pelvic health content.